Hi, Boaz Kolodner here. So today I would like to talk to you about the importance of root treatment in clinic. So a story that I had just a few days ago while doing a presentation in front of my students. Students bring in their patients, and one of my students brought in a patient suffering from back pain for the past 5 years. She's been doing all the tests, MRIs, CTs, and she's just about to do surgery for her back because she had I think a disc prolapse. Now, one very important thing I want to say here with CTs and MRIs. We'll begin the story with a clinical trial actually that they've done in Canada, if I'm not mistaken. They took I think over 300 people, asymptomatic, meaning no pain whatsoever, between the ages of 30 and 60. 300 of these asymptomatic, pain-free people, and they did a series of CT and MRIs, and 70% of them had pathologies or severe pathologies in their back, in their spine. Degeneration, disc prolapses, and what this tells me is that when a patient comes into me with back pain or meniscus or shoulder pain, and they're complaining, and the CT or MRI, they come usually with a test from the orthopedic, and it says that if they have disc prolapse, this is not necessarily the cause of pain, and usually the cause of pain will probably be soft tissue surrounding that area. In this case, patient is lying down, and I'm palpating her because that's what we do in Japanese acupuncture. And I'm palpating, and I see that her immune reflex is sensitive. Now, I've done a whole series of videos about root treatments and immune treatment. The immune system treatment is one of the most important. So as I find this immune system reflex, which is the right side of the navel at the area of the ileocecal valve or the appendix area, we're talking about stomach 26, 27 on the right side. Of course, she says it's painful, and then I start asking her, have you been having sinus infections or throat infections? And she said, yes, I've been having colds throughout my whole life. I'm always having colds. I'm always having throat infections, on and off, on and off. And this, of course, makes my mind pop and say, okay, I'm going to check the connection of this root treatment of the immune system and back pain. Because when we have a focal infection, meaning like a sinus infection or long-standing throat infection in her case, this weakens the connective tissue and gives rise to pain. And actually, pretty common to see this. This is why it's called root treatment. And I talk a lot about this in my videos. What I checked is whether one of the immune points, which is the area of large intestine 10-11 area, does this release the pain in the back? And of course it did, because I wouldn't be telling you this story. So I'm pressing the large intestine 10, and her back pain feels better immediately, meaning the trigger points at the area of bladder 23, 24. Her pain was at the quadratus lumbarum area, bladder 23, bladder 52 area. So I treat her immune system without even treating local points, without even treating bladder meridian points. And I'm treating these points, the immune system, and that relieved her back pain. And later, my student came up to me and said that only after this one treatment, and she was supposed to go to surgery, only after one treatment using the immune system, that her back pain pretty much completely disappeared, which I think this is amazing. So I have a lot more to share with you, especially on root treatments, which is the most important aspect as the beginning of treatment. And please join our inner circle where we'll have a lot more videos and upcoming news and be informed when new videos come in place. Thank you very much. This is Boaz Kolodner here. Thanks. Bye-bye.